COVID-19 cases rise in the community among adults, doctors say it is critical to remember that kids also get COVID-19 and can become very sick and then, of course, pass it on to others. I'm joined by infectious disease Dr. Andrew Pavia with Intermountain Healthcare today. Dr. Pavia, thanks so much for taking a few minutes to be with us. Let's talk about the rate of infection in children right now.
Well, thanks for having me on. When we talk about children, not all age groups are the same. We're seeing enormous increases in the number of infections in children in the high school age groups. In fact, they have some of the highest case rates of any group in Utah. And the numbers are still pretty low in elementary age kids. But to date, some 11,000 children in Utah have tested positive.
Why do you think that is? Is it because of the socialness of the older children in that high school level, perhaps being able to go out and do more extracurricular activities or having more time away from their parents?
Well, we know that high school age children interact a lot more with each other. In school, they have different classes throughout the course of the day. They're not with the same kids all day long. They participate in sports and extracurricular activities, and then they hang out with their friends afterwards. I mean, that's what you do when you're in that age group. The problem is not that they want to be with their friends. The problem is that they're not doing it safely.
Okay, when it comes to doing it safely, we've all heard it time and time again that wearing a face covering works, also keeping social distance, washing your hands on a regular basis. What else would you add to that, Dr. Pavia?
Well, I think for young people, it's really important to realize that some of your friends may be infected and not have symptoms. In everybody, there's 25 to 40% of people who are infected won't get sick enough to seek medical care. And in children, that number is a little bit higher. So anybody could be infected. You have to treat them as infected. Wear your mask, watch your distance, wash your hands. And we really also need to think about the other things that we like to do, and that includes sports. So, just because you're playing a sport doesn't mean you're protected. It's helpful if you're outside. It's helpful if that sport is one you can wear a mask in. It's helpful if that sport is something where you don't have a lot of close contact.
I use these precautions with extreme caution and just really remember that they do work. We've heard it again, time and time again, Dr. Pavia. So we appreciate you. Thank you so much. Do want to throw out that if people want to learn more about COVID-19 in children, also the symptoms and how to prevent it, go to fox13now.com and click on the Wellness Wednesday tab. Thank you so much.